Francisco have a lower life expectancy at birth than do most people in immensely poorer China or even India. Indeed, location alone may not enhance one's overall longevity. Explanation and remedy. How can we come to terms with the extensive presence of such adversity, the most basic privation from which human beings can suffer? Do we see it simply as a human predicament, an inescapable result of the frailty of our existence? That would be correct had these sufferings been really inescapable, but they are far from that. Preventable diseases can indeed be prevented. Curable ailments can certainly be cured, and controllable maladies call out for control. Rather than lamenting the adversity of nature, we have to look for a better comprehension of the social causes of horror and also of our tolerance of societal abominations. However, despite many illuminating studies of particular aspects of these general problems, investigators tend to shy away from posing the questions in their full generality. To confront the big picture seems like an overpowering challenge. Paul Farmer, however, is not easily overpowered. He's a great doctor with massive experience of working against the hardest of diseases in the most adverse of circumstances, and at the same time, he's a proficient and insightful anthropologist with far-reaching discernment and understanding. Farmer's knowledge of maladies such as AIDS and drug-resistant tuberculosis, which he fights on behalf of his indigent patients, is hard to match. This he combines with his remarkable expertise on culture and society, acquired not just by learning from a distance, but also from actually living and working in different parts of the deprived world. In addition, Paul Farmer is a public health interventionist, with a dogged determination to work toward changing iniquitous institutions and mismatched arrangements. As the co-director of Harvard's program in infectious disease and social change, working with Dr. Jim Yong Kim, another remarkable public health expert, Farmer has led several major initiatives in changing the direction of healthcare and intervention, for example, in tackling drug-resistant TB. But what is particularly relevant in appreciating the contribution of this powerful book is that Paul Farmer is a visionary analyst who can look beyond the details of fragmentary explanations to seek an integrated understanding of a complex reality. In his earlier publications, including AIDS and Accusation, 1992, The Uses of Haiti, 1994, and Infections and Inequalities, The Modern Plagues, 1999, he has already done much to illuminate important features of global deprivations. Now, in this remarkable book, which is hard to put down, comes the big picture, firmly linked with informationally rich illustrations of individual examples. Farmer points to what he calls structural violence, which influences the nature and distribution of extreme suffering. The book is, as he explains, a physician-anthropologist's effort to reveal the ways in which the most basic right, the right to survive, is trampled in an age of great affluence. He argues, human rights violations are not accidents. They are not random in distribution or effect. Rights violations are rather symptoms of deeper pathologies of power, and are linked intimately to the social conditions that so often determine who will suffer abuse and who will be shielded from harm. Those social conditions and their discriminatory effects are the subject matter of this general investigation and the specific case studies that establish the overall picture of powerlessness and deprivation. Concepts and methods. Some will undoubtedly ask whether this is not too general, too grand, and perhaps even too ambitious an inquiry. Also, are the questions absolutely clear? How exactly is power defined? Does Farmer delineate the social conditions precisely? Does he provide an exact definition of structural violence? In fact, that is not the way Paul Farmer proceeds.